Welcome, everyone. Wish I could see everyone.
No. If you just joined us, please feel free to use the chat to say hello and let us know where you're calling in from today. We'll get started in just a minute or two. If you just joined, please feel free to use the chat to say hello to everyone and let us know where you're calling in from. We'll begin in just a minute or so. All right, why don't we go ahead and get started? Thank you everyone for joining us today. We are so happy to see you on this Friday. My name is Erin Price. I am a social worker. I'm also a young breast cancer survivor. I was diagnosed just over 10 years ago in my 20s, and that really profoundly changed the trajectory of my life and my career. And shortly after going through treatment, I decided I wanted to get more involved in the young adult cancer space and the cancer space, and switched my work to be in the cancer world. And I also started volunteering with YSC at around that time. And then later went to get my master's degree in social work. So I'm so excited to be here moderating the session today. We are excited to have Kristen Nelson with us to discuss the psychosocial impact of COVID-19 and how that has impacted cancer survivors, and also that added psychosocial layer of decision-making when it comes to vaccines and what we all have to be thinking about. So I just want to orient you to what is going to happen today. So Krista will begin speaking in a little bit. Again, please feel free to use the chat to say hello and also let us know where you're calling in from. Please use the Q&A box in the bottom right corner of your screen for any questions. Try not to put your questions in the chat. Please use the Q&A if possible. That should allow you to upvote questions that you want to be answered. And also just a reminder that the session will be recorded and it will be available for viewing at a later time if you wanted to share it or view it again. And one last note, you will receive a link to a survey about this COVID vaccine session after the event. And we really hope that you'll take just a few minutes to complete the survey, give us some feedback so that we can continue to create really impactful and meaningful programming for you. All right, so now that we've got that out of the way, let me introduce our speaker. So Krista is a licensed clinical social worker and an oncology social worker, and she splits her time between clinical care of those with cancer and research. She provides individual support as well as group support for those affected by cancer, and she facilitates a YSC online support group for young women with metastatic cancer. Krista defines her role as providing support for people and their families throughout the cancer continuum and shares the expertise that she has learned from patients with cancer. What she loves about working with those affected with cancer is, quote, being able to witness the grace, courage, and life lessons of individuals dealing with cancer and the opportunity to be part of that journey. Krista is the president of the American Community of Cancer Centers. She loves being a part of the national discussion involving the psychosocial care of people with cancer. She has been a speaker at local and national conferences on issues of survivorship, palliative care, distress screening, and children who have a parent with cancer. All right, I will hand over the mic to Krista and take it away.
Well, thanks so much, Erin, and thank you for everyone who is calling in or watching today. We're just, like Erin mentioned in my bio, I'm just so grateful to have had this career and this opportunity to walk alongside with many of people like you, or maybe some of you, in your cancer journey. Today, I wanted to spend a little bit of time talking about psychosocial emotional support, dealing with COVID. And I'm really hoping that we can spend the bulk of our time discussing, answering questions, and hearing a little bit from you as well. I think we have a mix of psychosocial providers as well as those living with cancer on the call. And so hopefully the words that we share today will resonate with all of you. And I know there's, like I like to say, the experts are really those who are living with cancer. I mean, you are knowing what it's been like through this past year. I think I want to start with just saying you're here, and maybe what prompted you to come to this is you're going through cancer in the midst of a pandemic, which is something that in our lifetime we've never seen. And in amongst that, you're in this community that's grieving the social injustice that was brought to light, and just bearing witness to so much suffering. And you may be feeling like you're suffering and experiencing this isolation on your own. I think when I think about the pandemic and mental health and people going through cancer, I mean, there are so many different issues that you may be facing. And mostly today, what I want you to leave with is that you're not alone, that there are things you can do to help support yourself, and there are people who can help support you. I can't imagine going through cancer treatment and then also bearing the responsibility of trying to suddenly work from home, maybe not having childcare, all these different things that you're balancing as a young survivor or anyone with cancer. Even if you maybe don't have children yourself, your teammates do, and kind of recognizing what it's like to do work with your cat in the background or whatever it is, it can be really hard. But I think just paying attention to the fact that things are really hard right now. When COVID first started, what I was hearing from women and those with cancer and their families was sort of this, hey, we have this dialed. We already have this skill set because we have been living with uncertainty. We have known what it's like to not know about the future, or dealing with the fear and uncertainty of the future. And I really liked working with women in that mode, or in that place where they were sort of looking at their communities and saying, yeah, how does it feel? We've been going through this a long time. We've been living with uncertainty, fear of catching something, fear of people, coming to work when they're sick, when you're in the midst of chemotherapy. So what I really saw a lot was people having an expertise who are going through cancer, sort of already developing the skills, but then also the burden of COVID. I think sometimes I heard then people reflecting, well, even though I've gone through this and there's this uncertainty and everyone's dealing with it, at some point COVID's going to end and my cancer journey doesn't. I may still have those fears and unknown experiences of uncertainty. And so I think it was kind of twofold, people feeling supported, like other people understood maybe a little better what they've been experiencing, and also sort of feeling a little isolated that their experience was not the same as other people. So if people were to come and say to someone with cancer, oh, I know how you feel now. Well, that's not the case either. I think really another piece of this has been working with people with advanced cancer and how they're making treatment decisions in the face of COVID. Erin, I think what I've seen a lot of is people saying, if this is what life is, feeling sort of isolated, not able to do these things on my bucket list, it's changing their perspective of how they make treatment decisions about clinical trials, or maybe going forth with more treatment. And I'm not sure how many of you on the call may have advanced cancer versus early stage cancer, or work with those who are in those spaces. But what I really see is some deeper discussions and kind of, it's really pushing to the forefront what is quality of life and what does it mean for people when they're making decisions in the face of COVID. Even if you don't have COVID, every treatment decision, how you get your care, everything is being impacted by COVID. Even for people getting treatment as far as being able to have their loved ones with them. When I think of palliative care, supportive care of people with cancer, you think about them being surrounded and supported by their communities. And yet here we are at Cancer Center saying you can't have anyone with you. And then the burden of that really does fall to who is providing that support. And so for those of you who may be feeling isolated in treatment, reaching out and asking if there is a chaplain or a social worker or someone you can meet with in your community to kind of help support with those things. I think I just wanted to start with maybe saying a few words about mental health and some things that we can do. And then I'm really hoping to hear from people in the audience too, kind of what your thoughts are. Number one, your mental health is as important as your chemotherapy. And in fact, treatment of someone with cancer is paying attention to their emotional and psychological needs, as well as any barriers that may come up with your treatment. There are things you can do to help with that. I think for me and my practice, and something I encourage, is a gratitude practice. We know in literature that thinking of things we're grateful for, even if you don't write them down or tell the people or the things that you are grateful for, just thinking about it will improve your quality of life, reduce colds, all kinds of good things. So thinking about in moments when things feel really hard, how to kind of maybe switch that to something to be grateful for. I think when you're faced with illness, what you're grateful for changes over time. And maybe even though it's someone who's maybe tough to deal with in the oncology office, or that, knowing that you do have this opportunity to get this treatment, just kind of looking through a lens of gratitude, looking for things to be grateful for, can really help kind of shift your mind a little bit. At least that works for me. I'd love to hear if other people have done things like that. For me, a big thing is mindfulness or mindful pause. I think it feels kind of overwhelming to tell people, oh, hey, you should start meditating right now in the most stressful time of your life. I mean, that's sort of a hard sell, but I do think guided meditation is a really great place to start. Or maybe just taking a few moments and focusing on your breath in moments when things feel hard. I don't know about you guys, but I have felt just sort of the noise of my community, the noise of Netflix, podcasts. It seems like more and more I'm not kind of spending any time in silence. And so I'd really encourage you, if you are like a lot of us who sort of always has something going or filling your space, maybe just sitting in silence a little bit, and maybe just spending a few minutes focusing on your breath or feeling how your body moves when you breathe. That might really be a way to sort of shift your mindset a little bit. And I think number one, the most important thing we can do is have some compassion for ourselves. Right now, things are super hard. They're hard for your providers. They're hard for your workmates, your family, and yourselves. So trying to, I don't know about you, I have a really mean inner critic that's always telling me what I should have done or what I could have done differently. And so instead of that, maybe turning down the volume of that inner critic, and instead allowing myself permission to talk to myself the way I would talk to one of my best friends. So one little trick I say is a story I tell myself about something. Oh, I should have prepared. I should have done this thing, is to kind of think to myself, could the opposite be true? Did I do the best that I could in that moment? And then I think the last thing you can really do to sort of help support your emotional health during this time is connection. So we know connection helps, whether that Thank you for coming today and listening and participating in this way. Connecting with others is very important. Maybe that's a support group, maybe it's therapy, maybe it's meeting a friend for a walk. Because I think in these times of COVID, the isolation has felt more intense, I think, for everyone. And in the context of having cancer, you may not have the same energy that you've had with other things. And so really figuring out ways to connect with yourself and with people who are helpful and meaningful to you, relationships that are important, or animals or nature, whatever it is that brings you joy. So I kind of wanted to start with that. And I think we also wanted to talk a little bit about vaccines and kind of the anxiety about vaccines. And so I'm curious to kind of hear from the group, if you've been able to get vaccinated, if you have concerns about that. Right away, I'll say you should talk with your oncologist about, what that means for you. I know in the community I've been working with, there's a lot of, I don't want to say rage, but frustration about not having access to the vaccine. Because for a lot of people, that does mean maybe a little bit of a return to life as normal, feeling like you're at higher risk and wanting to get that protection so you can live life and enjoy life and participate. So I've said kind of a lot. Oh, good. I've seen some people saying you've received your first shot. That's great. I think it's important to do what feels best for your healthcare team in that, but it does, I'll tell you myself personally, having been going to work for a year without a vaccine and then going to work with a vaccine, it does feel a lot safer. There's just a sense of kind of relief that I feel, just knowing that I'm not potentially also spreading COVID to the people that I work with. So people like you. So Erin, how does that sound like a place to kind of pause and maybe go to some questions? Does that sound okay?
Yeah, that sounds good. We've got a couple in the queue already.
Okay.
I think one that, we can start with as we're talking about vaccines and the fears around it, the uncertainty, that there is a lot we don't necessarily know about the vaccine, though there is a lot of research out there. Someone's expressing some concerns around, whether getting the vaccine could make their cancer progress or might just impact their health in a way that maybe they don't know. So we're not medical providers, but I'm curious if you have any thoughts around that.
Yeah, I think there is so much unknown. And there's so much unknown with your specific cancer. I do know that all the national societies, so groups of people that work with people with cancer, are recommending this vaccine. The research on the way that some of these vaccines were done was really started with oncology. The way that they're doing this targeted vaccine and this target model of potential vaccine for COVID. The truth is we don't know exactly. And I think it's really important to be able to share your concerns with your oncologist. One of my best friends has stage 4 breast cancer, and I know she's really been working with her oncology team, and she did decide to get the vaccine because the risk that she knows versus the risks of the unknown felt like the best decision for her. So I think acknowledging and knowing that your concerns are real, but then working with your oncologist around what the evidence says for you and your treatment is really important. So thank you so much for sharing that concern. That's very brave, and it's very valid.
Yeah, absolutely. So switching gears slightly, there was a question around communicating with family and friends. So in this instance, someone shared that it seemed like their loved ones weren't necessarily feeling as concerned about the patient's safety and well-being as the patient feels they should be. So how can we better communicate with our loved ones that we are still concerned. We still feel we need to be protected during COVID, even after getting the vaccine.
Yeah, great question. I think, first of all, family safety or family communication is complex. And so, we're all part of families. We all have family. We understand. I think what COVID has done is it has raised awareness to other people in your family that may not know what it's like to sort of live with an elevated level of uncertainty, what that may be like. And I think it depends on what your family dynamics and how you communicate with your family, how that's been going up to this point. But I think my favorite thing to promote is absolute communication is best. So sharing your experience and your fears. But I think it's important to sort of schedule a time or make sure it's a protected moment where people are actually paying attention, and you say, hey, I want to give you an update on what my oncologist shared with me about my risks and concerns. And so that you have people's undivided attention. Like I was speaking earlier, there's so much noise and people with their phones and looking at their phones on their watch. And, I think just making sure they can hear your real concerns. Because like I said, a lot of patients are telling me, I haven't gotten colds because I'm wearing a mask, and all these things have really been helpful. So I think being sure, we absolutely don't know for sure, and it doesn't hurt to wear a mask. I mean, if that's something that feels important and meaningful to you, I don't want to get into any politics, but I wear a mask all day, every day, and I'm just used to it. So even though my community, my parents, we are vaccinated, we're inside with other people, just wear a mask, and you can easily wear a mask, take a drink of water, wine, whatever it is, and put your mask back on. So I think helping people know what makes you safe, feel you safe and you comfortable, let them know that. And if you have trouble with that or want to brainstorm how to exactly words to say that, encourage you to reach out to your oncology social worker or mental health provider in your clinic to help you kind of work through that personally. Thank you so much. I hope that answered your questions. I wish I could see you, but then maybe some people might not be as brave to ask the questions. So benefits to both.
Thank you so much for your thoughts on that. Communication is so important and really a challenge throughout the whole cancer trajectory, not just with COVID, but heightened now. Yeah. So a couple of people asking about favorite suggestions to cancer survivors to manage anxiety. And we all know that cancer survivorship full of anxiety and extra heightened anxiety during this last year.
Yeah, I mean, my favorite ways. I mean, the truth is what works for one person may not work for the best, but typically, and what really is working, I think, is connection of an opportunity to share what it is you're holding. I think sometimes what makes us most anxious are things that we have no control over. And so sometimes saying it out loud to a social worker, a therapist, your physician, your medical team, nurse, it gives some of the power of that thought that you're thinking away. I also want to say anxiety is normal. There is a level of anxiety that is absolutely normal to experience when you have a diagnosis of cancer. So a lot of people say, oh, as I'm nearing treatment, I don't know, Erin, if you have times in your experience when you were more anxious or less anxious, if you want to speak to times that.
Yeah, absolutely. I mean, I think personally, both in cancer, but also in life, my anxiety is heightened during the times when things are most uncertain, right? And so, I know many of you can relate to this, but that time between diagnosis and treatment starting often tends to feel sometimes the most anxious time, or the time right leading up to a scan, or right waiting for your results. That uncertainty really fuels anxiety. And so sometimes I think, trying to focus on things that we know, or, what do I know to be true? What can I control? What can't I control? Uncertainty really ties to control, and we are all keenly aware of how much control we don't have right now, and that's really, really hard. So sometimes just trying to be present and just focusing on the right now can be helpful.
Perfect segue into what I wanted to say. So I think acknowledging the anxiety, acknowledging that it's a hard time, I think acknowledging that you're not alone in it, that anyone in your situation would also be experiencing that. And I think mostly as you feel anxious, as you feel it in your body, I like to identify, where do I feel it? Do I have a shortness of breath? Do I have tension in my shoulders? Am I acting in a different way? And then really focusing on, what do I actually have control of in this moment? And typically the things I'm anxious about are a bunch of what ifs in the future. So they're not knowns. So we see a lot of times people, when they're going to meet for the oncologist at the first time, their anxiety is sky high. And then after you meet with the oncologist, when you have a plan, when you know a little bit more about your treatment, you feel better. So acknowledging that and paying attention to that and letting go of maybe what you don't have control over. I think as far as managing, so mindful pause is really helpful. What we're talking about a little bit is really a type of therapy, cognitive behavioral therapy. So kind of going into your head and saying, okay, take it out of your heart into your head. Okay, what do I actually have control over? Could the opposite of this be true? Let me try to just breathe. Distraction works really well. I think hence all the Netflix and podcasts and things. Exercise, absolutely a great way to kind of help get out of your body, out of that feeling in your head. Those are the big things. I think the other thing I really do encourage is participating in support groups or connection with other people. In a well-supported group, it's not really the what happened, but it's more of the heart talk. So, what is going on for me? I'm feeling super anxious, just to hear that that's a normal response and that other people are feeling that way too. And then I think really working with someone individually. Most of you likely have an oncology social worker that you can see for free in your clinic, your oncology clinic. So working with them just even for a couple times for some anxiety management. They may have you kind of write down a thought log on things that are making you particularly anxious, and then kind of having you work around stories or different ways to think about those things.
Yeah, great tips. There's a lot we can do, and at the same time, a lot we can't control. So just how can we cope and, get through this moment and to the next moment where we might know more. So we've mentioned connection a few times. So here's an interesting question, but I think one that's very apt for the moment. How are we feeling about connections to our medical team? We went through this time. If you were in treatment prior to COVID, you had a personal connection with your providers. You saw their face, you shook their hand. What if you're now feeling like you missed that personal connection between your provider? They're not going to shake your hand right now. You can't see their face. They're such an important part of your life. How do you not take that personally?
That's a great question. And what I want maybe whoever shared that and others to hear is that your providers and your care team are missing that connection as much as you are. One thing I think that's important is just to speak to it. A lot of times I'll put my hands out and say virtual hug, and I'll just say, I miss connecting with you in that safe physical way if it's someone who wants that. So I think it's really honoring what feels important to people and what people feel safe with. Some patients I can tell you right at the beginning when we didn't really understand, I had a loved one of someone I'd worked with for a long time died. And the family member sort of just said, I don't care about COVID, and threw their arms about me. And I held my breath. I recognize that need to connect, but I also have to think about the way that I behave and the actions of connecting with you will impact everyone else I come in contact with that day. So a part of not shaking your hand is also really my way of protecting you. So I think if you can, again, change the mind around, it isn't around that they don't want to connect with you. It's how they know how to protect you the best that we know. Because there's not 100% evidence. There's nothing that's 100%. So we don't know. And so we are kind of always mitigating risk and benefit of how we can best support you and keep you safe.
Yeah, great point. At this point, not physically connecting is the best way to show that you care, which is a big shift in thinking. Mm-hmm. So have you been able to provide support for cancer survivors or those in treatment who might be ineligible for the vaccine at this time? And how are those conversations going?
It is. I have. I think it is either people don't have access to a vaccine right now, or I think people who don't have access to a vaccine, or that because of the treatment that they received, whether it's an immunotherapy or something, they're not able to get the vaccine for a while. There's grief in that. And I think one thing that has helped them feel more safe in my community is that people continue to wear masks, people in spaces. And I honestly don't imagine a time anytime soon where we won't be wearing masks as cancer care providers anytime soon. Because the truth is, we don't know who we come in contact with who isn't vaccinated or not, who is or isn't. And again, there's, the evidence is changing every day, and I know we're all very hopeful, but there's small percentages that, they can't say with 100% that we're not able to pass the virus on to others, even if we're asymptomatic. And so those small percentages, I think most of us worry that we would hurt someone that we care about a lot in providing support by putting them at risk. I think with the people who haven't been able to get it, it's just really supporting the grief in that and acknowledging that on top of everything else is just really hard. There is I think the people I've worked with have some feeling of comfort because the people around them as caregivers are vaccinated. And so that's offered them some support. So in my community, and likely yours, people who are caregivers of someone who's medically fragile have hit the vaccine lottery, so to speak, so far. So I think it's just kind of making the best decision for those individuals, but also honoring that sense of, once again, being excluded or different from others, and supporting the grief around that.
Yeah, great points. And just a tough situation right now with how things have moved and are moving. So this is a bit related. You've talked a little bit about, we may be wearing masks for a while. Even if vaccinated, it may still be prudent to wear a mask. There's certainly been some various guidelines from the CDC, some things that have come out. It's still very uncertain. As not a medical provider, but based on your knowledge, are you aware of any evidence or reason that you're encouraging cancer survivors and thrivers to still wear a mask even after being fully vaccinated?
Well, I think people have to make, the hard part is we know what we know right now in this moment today. And so every day you need to feel good about making your decision based on the evidence, what your physician says, and what your community feels comfortable with. It may be that in recommendations, if your pods are around other people who are vaccinated, there is some discussion around that is safe. again, people need to make their own decisions that they feel comfortable with. And in my experience, that also means honoring what other people feel comfortable with. So to say, for you to be able to speak your truth and say, we don't know for sure. I think, when you think about hope in COVID, and it's spring and a lot of people are getting vaccinated, and that feels hopeful. And then there's also this sense of like, I'm kind of scared to be hopeful and waiting for a shoe to drop because maybe there's this variant from Brazil or this variant that's not going to be protected. And so all of that unknown, to be able to speak for you, your truth about what you feel comfortable with. And then it's a balance too of quality of life. I think nothing is 100% in this world. And so I really encourage you to talk with your loved ones about what feels good and safe. And I think one thing we've seen in my community, and I'm sure others have, is like no one's really had a cold. There's barely any flu in my community this year. So there are some positives about the ways that we're kind of looking at public health and taking care of each other. That being said, this is one true beautiful life, and you have to make sure that you're living it and doing what feels good to you while honoring the people in your community. You can only say, this is what I need, and then people can choose to meet you there or not. I don't think anyone knows any total right answer right now. That's kind of my experience of that. I wish you could like argue with me if you didn't agree or tell me your thoughts. But again, just remember, these are just my perspective. What do you think, Erin? How did that resonate with you?
I mean, I think that was a great answer. And I think, as you said, we know what we know. As we very well know, our knowledge around COVID has evolved completely over the last year. We know things now that we didn't know 9 months ago. And I'm sure we'll know things in 9 months that we didn't know today. So we have to, with everything, make the best decision for us today in this moment and know that we did our best. That's all we can do in anything, I think. So,
yeah.
So the $1 million question, and I get this a lot, and so would love to hear your thoughts on it. How do I find a good, inexpensive, or takes insurance or whatever it is, therapist that specializes in cancer?
Yeah, so number one, I'm all about getting services for free. So number one, start with where you get your cancer care. Most programs that are accredited have to either provide or refer to someone who specializes in oncology. So your doctor's office, they absolutely should be the first place to start. Different social work programs have different capacities. So they may say, we can see people 4 times for a certain thing, like anxiety management or something. Or if you have advanced cancer, please ask for palliative care. That could be a whole nother hour talk, but it's an extra team. It doesn't take away from your treatment, but enhances the support of you and your treatment. So if you have stage 4, you're likely eligible for palliative care. So I'd ask for that, and then that automatically comes with psychosocial support. Thirdly, there are some national funds that are helping people pay for psychosocial support, like counseling. I know for sure Cancer Support Community has one or resource. They're a big national organization, and so I would start with their webpage. Sorry if I had that question ahead of time. I would be Googling it to find out for sure. I think the other one is Healthwell Foundation has a fund. Oh, Erin's nodding her head. Yes. Okay, good. So
I was going to do that if you did.
Okay. So those two, they actually help pay for copays or treatment. And I think they're like $2,000. That's a lot of visits. So hopefully that will be a good resource for people. And I'm sure they can put some resources on the Young Survival Coalition's website too, as follow-up for that.
Yeah, it's absolutely finding good mental health care is super important and always a challenge, but
I think,
oh, go ahead.
Sorry to interrupt you. I was just going to say the other way is to maybe ask other people like in your support group or a hangout with YSC who they're going to, because likely someone in your group has found someone that has a good understanding. The truth is most therapists are well trained in dealing with grief and anxiety and depression. And, regardless of your circumstance, those are often what we are treating. And so don't be discouraged. I think have a half an hour interview with a therapist on the phone that isn't charged to make sure it's a good fit. That's what I would encourage. Sorry, Erin, to interrupt you.
No, that's fine. And know that just like with a doctor, if you don't gel with the therapist right off the bat, you don't have to continue seeing them. They will understand this is a process. You have to get a good fit. So
I think another piece too, having a sense of what your goals are for the treatment. Like, what are you hoping to get out of therapy? And maybe you just say, I don't know, I've never been to therapy. This woman said I should get therapy, but working and talking that out with the therapist is important. They want you to feel good at the end as well.
Absolutely. So continuing on this string of how to find a therapist and how to find good mental health coverage. So there's a very specific question here about, as a deaf person feeling even more isolated during this time, they've been looking for a therapist and they can't find any people that practice using ASL, American Sign Language. They also find it challenging to read lips when people wear a mask, which is absolutely obvious. And for safety, we must wear them. So, and I'm sure there are a million other special circumstances, whether it's a language issue or some other consideration. Do you have any tips for when you do need to find a niche therapist, even if it's not in the cancer space, where to look? Are there some national resources to kind of search for that?
Yeah, Erin, thanks. I definitely would go to national associations for the deaf that support disabilities. I think there are some therapists that have shields or masks that have a clear space for the mouth so that you would be able to read lips. I can't remember who made that shield or that mask, but there are masks that have been made for that exact reason. I think, again, if you're in cancer treatment, your oncology social worker at the office can help you find a resource. They might not, the pressure is we get, 200 requests a day. Hey, I need a therapist. And number one, we want to see is the issue around cancer. If it's around cancer, your community there might support you. Two, it may really take you understanding your insurance issues. There are free and no cost clinics, but there's also a multitude of therapists who are available to you through your insurance company. So going to the panel and seeing there, spending time. Sometimes people use things like Psychology Today. There's like a Find a Therapist app where you can click. So there's a lot of different ways. I would just say, if you feel stuck, reach out and ask for help from someone in your local community, or reaching out to the cancer support community or cancer care. Both of those have psychosocial support available to kind of help you brainstorm, and social workers will help you figure that out.
Great suggestions. I see that Jean put in the chat a few resources for specifically for deaf therapy, but also Psychology Today, which again allows you to search for a multitude of different specialties, types of therapies, languages, types of insurance. So it's actually a really great way to find a therapist and screen some people.
Great. Thanks, Jean.
All right. Yeah, thank you, Jean. So have your psychosocial support recommendations evolved over the last year? Is there anything you're recommending now that you maybe wouldn't have suggested a year ago?
Yeah, I think mostly what we've seen are virtual groups. I think before I really loved and believed in the opportunity to connect in person. So I think I've really encouraged people to try it out. I've been shocked at how connected I can feel, and I think our group can feel by sharing, by participating in a virtual group. I also think it's alleviated a lot of barriers. I think a lot of people are able to participate that didn't. Maybe they're working from home and now they can just take their break at a time of a group and participate without having to drive anywhere. I do think a big piece that has changed in my interventions as well is really acknowledging the grief and working through some grief response to what's happening in our communities and I think encouraging people to also be aware that everyone that they encounter is suffering. So I think right now we're seeing healthcare providers really suffering as well. That as much as you miss connecting, they're missing that connection. And so we're seeing a lot of burnout of staff. And so, I mean, maybe just sharing what you miss about connecting face to face or that too is helpful because I think that would be the thing is that just kind of this grace that everyone in your community is experiencing suffering right now through societal suffering or institutional suffering or just your own inability to connect or maybe have the support that you had prior to COVID. So figuring out, I think I spent a lot of time figuring out other ways to help people feel supported and connected to their bodies and to their communities.
Yeah, that's those are some great points, and certainly we're all dealing with that accumulated grief right now, and that, you know, while their grief is a big part of cancer, it feels very compounded right now. So have you, in your experience working with young survivors or even, you know, cancer survivors in general, have you gotten any experience or sense of how they're doing with managing the side effects of the vaccine? Are they having worse response, better?
That's hard to know because I only know anecdotally, but I can speak to, I haven't seen anyone have a reaction that's needed any more support than someone who didn't have cancer. So we have now a lot of people in my community that are starting to get vaccinated even while on chemotherapy. And they've been doing fine. They have had, you know, depending on the vaccine, some people have more of a reaction to the second vaccine. I think that's what we're seeing in general, but that's sort of immune system, right? Your immune system's responding to something, but it hasn't limited their ability to get treatment. But I think the timing of it is, you know, important when you're on chemo to talk to your oncologist about. And if you have advanced cancer, the oncologists I've worked with have said, just get it and we'll deal with it then, you know, for people who are on regular treatments. So I haven't seen that anecdotally, and I don't know the literature well enough, but I do know all sorts of people got the vaccine in the trials, some of the trials. So we don't know, but I haven't seen it bad where I am. And I'm in Portland, Oregon, just so you know.
Yeah, it's so hard to know because everyone's such an individual in their reaction.
Yeah.
So we are at the end of the questions that we currently have. Though I do have one more question that I'd like to ask. You know, we know that cancer survivors, and you and I have seen this firsthand from working in this realm, that there are incredible moments of resiliency just in a general cancer diagnosis. And I'm just curious if you've seen extra areas of resilience or any, you know, wonderful ways that they have coped or figured out to how to adapt during this extra hardship.
And that's such a good, there are so many examples of how people are doing things in ways. It reminded me, I was looking through a slideshow of COVID. I kind of took pictures on my phone as the year has gone on so that I would remember things, you know, I wouldn't forget. Like I have a picture of toilet paper. Like I forgot that it was hard to get toilet paper, and I forgot that the shelves were empty, or you know, all these different things as we think about what we've been through in the year. And I've seen just what I've appreciated are the moments of humor. I have a neighbor who put up made their giant bush a person, like had googly eyes and a mask over it, and We've seen patients come in decorating their masks. I mean, there's so many great ways that people have stayed, celebrations of drive-by parties to celebrate the end of treatment. I think also honoring lives, honoring deaths through different ways to do funerals or to honor or remember people. I think one way that I saw they really used social media as a way to connect with each other, and they made a hashtag up for the person's name, and thought that they were someone who always uses kindness. And so they asked the community to go out and do random acts of kindness, take a picture of it and hashtag it and send it, so they could follow each other on social media if they didn't know with the hashtag. So I think there's so many creative ways. What have you seen? Anything interesting, Erin, or something that comes to mind?
Yeah, I echo that. People have really been finding really creative ways to connect and be expressive during this time. I know I love that, hearing that people were decorating their face masks. I can think of one person in particular who would wear different hats that had sayings on them as their way to sort of express to the whole chemo room, like, we can't have a conversation, but I want you to know what I'm thinking today. And I echo the sentiment of, people are just finding creative ways to connect, and that while we have had to make a lot of concessions and changes in order to connect virtually instead of in person, it has a lot of opportunity for reducing those barriers. At the organization where I work, we do run a lot of programs and support groups, and we've had more people participating over the last year than when we were in person. And we've had a lot of people participating when they are immunosuppressed, not feeling well. They can do support group from their bed, which was not something that they could do before. And so I think there are some silver linings. Obviously, we don't want to be in a pandemic. Obviously, we don't want to get cancer. But when those things happen, people have adapted. And I also appreciate your comment about the humor, because I think we all know cancer patients and survivors are some of the funniest people around. That gallows humor is just second to none. So I encourage you all to keep the humor and keep finding ways to make the best of it.
It makes me think about, you mentioned the group, people have been able to participate when they're on hospice and end of life groups. Yeah. Also, one of my favorite things is we had a show and tell group. We started, instead of like an opening thing, everyone showed something that brought them comfort, and we got to meet everyone's pets. So there is some fun things that we wouldn't have had to be able to participate. Is I can think of many groups where someone's cat or dog walks over them, and just knowing that that's them getting love. So I don't know, it's been fun in some ways. And I think we'll always have some virtual now. I think we'll always have some hybrid of in-person and virtual, so that everyone has access.
I agree. Yeah, it's definitely turned things on their head, but not necessarily all in a bad way. So. All right, well, we don't have any more questions, so why don't we go ahead and wrap up so that you can all get on with your Friday. I want to just take a moment to thank you so much, Krista, for joining us and serving as our expert speaker today. It's been so wonderful to chat with you. YSC's next COVID-19 installment will be in April with Dr. Vivian B. and Desiree Walker, so stay tuned for more details. And if you're interested in other YSC programs and support, including the virtual YSC Summit that's coming up in May, please visit their website, youngsurvival.org. And once again, you will be getting a survey link. So please just take a minute or two to fill that out, so that YSC can continue to provide you with programs that are helpful to you and give you the best information and tools possible. Thank you so much,
Erin. Thank you. Everyone, be gentle with yourselves, and just know you're not alone.